doing my PhD on actually social protection for Sudanese migrants in the Netherlands and in the UK, but I started like 7 months ago. And the Sudanese population are not easy to research. There's not a lot of research done, which I think is a shame, and that's why I'm working on it. So hopefully for the next conference, I could present my results on the Sudanese diaspora or migrant population. But for now, my topic my topic for today will be a bit more general, but it's closely linked to the previous presentation, which I really liked a lot. So I will be talking about the different institutions providing social protection or social welfare for international migrants within a mobility framework. So, according to the latest report of the International Labour Organization in 2014, only 1/4 of the worldwide population had access to comprehensive social protection. That is very little. And the thing becomes even worse if you think that most welfare systems are geographically fixed to a nation state. And they usually cover settled populations. So if you think nowadays where more and more people decide or are forced to live across borders of different nation states, this becomes a problem. On the one hand, migrants, when leaving their home country, they might lose any benefit they might have been contributing to in their system, in their home system. And then when arriving in a new country, especially in Europe and other developed countries with relatively strong welfare systems, they might have to wait for several years in order to gain access to any benefit. And that's if they ever get access to some sort of benefits, because, for example, undocumented migrants, they will lack any sort of access. But then, on the other hand, there is this trend encouraged by several international organizations and also governments where migrants are depicted as the development actors of their home countries. So by sending remittances, migrants end up funding health, education, and other services that their governments might not be able to fund or to cover. Some authors recently have gone as far as saying migration itself is a form of informal social protection. So if we bear this in mind, most studies and most research done on social protection or social welfare for mobile populations, they focus either on what the migrants receive in the receiving country, and if we talk about Europe or more developed countries, you will talk about the state-provided support, or the informal part, that is the help migrants provide for each other, and also the remittances sent back home. So it's either or, formal or informal, here or there. What I propose in this paper is to approach the topic from a more transnational perspective, that is to say, considering here and there, and the formal and informal, and the linkages that might exist in between. And this is something, I guess, like we have been touching a bit in the previous presentation also, like this diaspora role, and this could be something to dig a bit more on. So, good. So I will talk a bit about what's understood for formal social protection and informal one, and then go to the linkages in between. When we talk of formal social protection, it's basically understood as state-provided support, regulated by laws and under very strict eligibility criteria, especially for migrants. When it comes to the state, most studies, especially in Europe, are focused on the access of migrants to social welfare or social security, maybe migrants abusing the system and so on and so forth, which might or may not be the case. In the receiving country, access to social security might be difficult, if not it might end up endangering the situation of the migrant here in some countries, for example. The very fact of applying for benefits might start the process to be returned back to your home country because you cannot provide for yourself, right? Then when it comes to the sending countries, some research, not so much, has been done on some countries like the Philippines, for instance, who put some sort of effort in helping the migrants in moving, and not only in the moving, but also in providing some sort of protection to themselves and their families back home. However, we should be a bit critical with this, our citizens have the right to migrate. is it a right or is it a need? Because, you know, life in that country is really hard, and if you don't migrate, you're gonna have it hard there. Then I'm sure you must have heard here in the European Union, it's now a big issue, this portability issue of benefits, especially when it comes to pensions. There is a big debate on whether pensions should be transferable. That is to say, when migrants return to their home countries, and that's if they return, they should be able to take with them the pensions because they have been contributing here for, you know, with taxes and so on and so forth. However, this system is really not too much implemented. It's very hard to implement when it comes to the planning and the actual implementation itself. And it might create inequalities at a regional level in the countries of origin. And then the market and international organizations can be also considered as formal social protection. The market, especially in some Latin American countries, there's been more and more insurance companies emerging, providing social protection or social welfare for the migrant and for the family left behind. So that is something to be researched, but however, the few examples existing nowadays, most of them are in Latin America, so it's very restricted to a very specific part of the world. It's not so sure if it will work for other regions who do not have this type of westernized insurance models, let's say. Also, it's very costly. It also limits to documented migrants, and it's basically based on health. So any other sort of benefit or support is just completely left out. And then international organizations such as IOM, for example, they fund some programs or engaging diaspora, for example, in knowledge transfer. There's been some programs on that with Sudanese community in the UK and in the Netherlands, so sending temporarily highly skilled migrants to Sudan in order to train other doctors or other people, depending on the topic they deal with. But that's basically the role of these organizations. They don't really touch on social protection itself. No. Then when it comes to informal social protection, we're basically talking about family and social networks, so what people provide for each other. There is a big difference, of course, depending on the countries you're talking about. In some countries, formal social protection is non-existent or very weak, whereas the informal one is really strong, like family links and community support. Here in Europe, it's kind of the other way around. But when you are talking about migrants, you have to consider both contexts, because it's not like migrants just leave their countries and, you know, they cut all sorts of links. The links continue and develop. And they also maintain responsibilities back home. So as I said before, migration has been conceptualized as a sort of social protection or social welfare. But the question is for whom? So if you think about it, when migrants move, they technically gain income, get better life opportunities, so that would be, you know, in their benefit. Then when remitting money, migrants might contribute with the well-being of the family left behind. Not so much research, however, has focused on the role of the actual family of the migrant who's left behind and might contribute in the protection or the support of the migrant, either by money, helping in the migration process, or taking care of responsibilities that the migrant has left behind, such as, for example, children or dependent elderly people. So when we talk about migration as social protection, we should consider whether it's really increasing opportunities for both sides or more increasing inequalities. So migration, for example, has been understood as this co-insurance arrangement, in that migrant would send money, and then so when returning, migrants would be, you know, taken by the family because they've been contributing towards them. This has been researched in several countries, and the result is that what has been found is that wealthier migrants would remit more because there is the inheritance, right, incentive whenever they come back. So that itself would create inequalities depending on the socioeconomic state of the migrant even before migrating. And then on the other hand, when migration happens, social networks back home might get disrupted. So any responsibility a migrant might have towards an elderly person or children or even housing will pass to other members of the family, burdening them with new responsibilities. So within this context, well, social protection, obviously, I would say, is made of the formal part and the informal part. It's not one or the other, and there are linkages in between. However, not too much research has been conducted on what some authors have called semi-formal social protection, and that is what happens in between. So this concept has been used by some authors talking about social protection in Africa and Latin America also, and also Southeast Asia. And it refers to sort of informal groups of people gathering for a common good, let's say. But they don't get any formal support or formal organization. They are self-organized, and they provide for each other as a community protection system, let's say, as Tansim was talking about yesterday. So, but as I mentioned, it's mainly been studied from the perspective of developing countries. Here, it's really not almost under research. And then especially when it comes to migration, it's quite completely ignored. The advantages of this sort of semi-formal organizations or associations is that they are very versatile, and they really understand the needs of a particular group of migrants in a particular country, and also the needs with the families back home, which are normally left, forgotten in the formal systems, for example. They can provide financial support, social support, emotional support, and other sorts of support, because they are not, they don't follow these eligibility criteria as the formal ones, but still they have very strong accountability agreements. So they're kind of strong in providing for people. When it comes to migration, as I said, they have not been widely researched. But I've been reading a lot about that, and I've managed to bring together these main 5 categories. So I won't go into detail on all of them because I think the time is going. But so the last 3 ones, I'm sure you're aware. You know them. So burial societies, migrants, gathering together to provide money whenever there is a funeral back home, or someone dies here and needs to be transported back home. They might be in some African countries especially, they are independent, they are very strong, these sort of burial societies, and they are independent, although in some other cases they are part of hometown associations or diaspora associations. Same happens with the faith-based associations and rotating crate associations. If you would like some particular example, I have a lot, but then later we can talk about that, so I don't want to go into details now. The hometown associations, for example, or diaspora associations, it has been shown that they have a very important role when it comes to political pressure and also development. So, like for example, a very good example of this would be in Mexico. There is several hometown associations whereby migrants gather together a lot of money, and they are able to build a school, for instance, or a well back home, or whatever it is. These organizations have obviously power. In this case of Mexico, they have been able to engage the government, not only the national, but also at the local and regional level. So there is now this big program happening where I think it's called 143. So every $1 a migrant sends, not individual migrant, like in this diaspora organization, the government would match it with 3. So, it's contributing a lot in the development, say, of a certain region or certain village. However, development is not always the same as social protection. If you build a nice school, and even if you train teachers, as the previous presentation was saying, it's all very nice. But then if you have a family who cannot make ends meet by the end of the month, and with a lot of children, they might decide to send children to work rather than sending children to school. So you have a nice school without children. So I think the diaspora organizations could play an interesting role in the provision of social protection or social welfare for the ones left behind. There are some examples, but not so many. And then the transnational healthcare insurance mechanism. Being in the Netherlands, I was aware of this sort of association or scheme happening in Belgium with the Congolese migrants. They are a big, strong group, also colonial ties, yeah, between Belgium and Congo. So the thing works, Congolese migrants in Belgium, they gathered together and they thought that medical, so the amount of money they were sending home for medical expenses and so on and so forth was a big burden on them. So they wanted to create something more like, you know, like a constant input of money, not so big, like a sort of an insurance, let's say, that would cover their families back home. So gathering together in an informal way, they joined forces with the local NGOs and also with the Belgian government and Belgian healthcare providers, whereby by paying monthly premiums, which is something that happens anyhow in Belgium, they cover themselves and also their families in Congo. So there is this hospital in Kinshasa where only 7 members of the families of these migrants are covered. So whenever there is a medical need, they can just go there and be taken care of without having to pay or having to urgently ask the migrant for a crazy amount of money, which is obviously a big burden on the migrant. However, this system is also has the challenges as well, because in a country with an extended family model, covering only 7 people might be problematic and might end up causing trouble in between your social network there. And also it has to be proved if it's self-sustainable or not, because so far it's been receiving money by the Belgian government. So theoretically it's been started with the aim of being self-sustainable, but it's still very young. So, but it's a beginning, I think. So, oops, sorry, I skipped one. Just final, very quickly, some concluding remarks. I think there needs to be a more holistic approach on social welfare and social protection for mobile populations, for migrants who are not here, are in both places at the same time. And they have responsibilities not only in the receiving country, but also in the sending country back home. So by looking at social protection from this transnational point of view and including what's in between, the linkages in between the informal and the formal, maybe elements of social protection to cover not only the documented migrants here, but also undocumented ones and their families left behind, could be more accessible for everyone. And then, well, this thing I found very interesting, I was just reading this report on social protection at the European Union level with also African leaders and stakeholders, and where they recognized the role of NGOs and diaspora organizations as political power and pressure and advocacy power. They were very clear in saying that civil society should not be seen as a provider of social protection, because, you know, then the state would be free, let's say, of this responsibility. But then again, if you remember what I said at the beginning, migrants that actually, individual migrants, are actually given now that responsibility of you become suddenly the actors of development and social protection of your country. So that's all. Thank you very much.